Hey everybody, it's Dr. Sierra. I'm going to show you how to use your sleep aids or your positioning rolls. So there's two rolls. There's a large roll and a small roll. And the way that I remember it is the large roll goes at the base of your neck. It's always going to be sitting right on this little bump that's right here at the base of your neck before your upper back. And then the small roll goes in the small of your back. So I'm going to show you some tips and tricks. But when you're talking about the small roll, the roll should be above your hips but below your rib cage. So in female patients, that's going to be a little more challenging to get in that small space, but you want to be above the hip and below the rib cage. So what we're going to do for the large roll, you're going to lift up your head and you're going to place it at the top of your upper back. You can go ahead and rest your head down. What you're going to feel is that the roll is going to be touching the top of your shoulders. It does not need to be up, riding up underneath your skull. What I like to do is take my fingers and slide them above the roll but below the skull to make sure there's spacing in there. If you have the roll too high, it could give you a headache. The small roll is going to be for the small of your back. The best way to use the low back roll is to bend your knees and put your feet flat. This will shift your weight up over your pelvis and your spine, and it's more comfortable to lay like that. If you're at home and you're laying on it for longer periods of time, which I'm going to discuss in just a minute, you can put a pillow or two pillows below your knees so it's more comfortable. So what we're going to do is we're going to lift up right here, and it's going to go in the small of your back. Good placement is when you can feel the roll is above the top of your hips, but it's not up on your rib cage. So how you're going to use these rolls, you're going to start by laying on them for 4 to 5 minutes so you feel comfortable getting in the position. If you have no issues, so one of the issues you could have is you could be a little bit stiff. If you start noticing pain, you're going to want to stop doing the roll, and then you're going to want to scale back on the time. If you feel great, you can add a few minutes every single day until you reach 20 to 30 minutes. Once you're comfortable laying on the rolls for 20 to 30 minutes, you can shift over and start laying on them in bed. My best suggestion is trying to fall asleep on the rolls, and then over time it just becomes second nature. In the beginning, if you're not going to sleep on them, you can do it on the carpet or you can do it on your bed without a pillow. You do not want to do the roll on the couch. So this is how you use the positioning rolls. Again, the large roll goes at the base of your neck and the small roll goes in the small of your back. If you have any questions, don't hesitate to reach out to myself, Dr. Neal, or you can text message the office.